Allergic rhinitis is one of the most common respiratory conditions worldwide. Studies show that around 17 to 25% of the population experience it at some point in their lives. It's especially common among students, working adults, and people living in urban environments. In industrialized countries, rates continue to rise due to air pollution and increased exposure to new airborne allergens. Several factors can increase the risk of developing allergies, including prolonged exposure to allergens, respiratory infections, genetic predisposition, and environmental conditions. Typical symptoms include an itchy nose, often accompanied by itchy eyes, ears, or the throat. Sneezing may occur in long, uncontrollable bursts, rather than single sneezes. A runny or blocked nose can lead to fatigue, headaches, and daytime drowsiness. Treatment for allergic rhinitis goes beyond symptom relief and focuses on managing the underlying cause. One specific treatment option is allergen immunotherapy, which aims to modify the body's immune response. Now, let's move on to ways to improve this condition. Today, we're going to explore simple ways to improve allergic rhinitis symptoms in everyday life. These methods are not meant to replace medical treatment, but to help your body feel more comfortable and balanced over time. Breathing is one of the most important starting points when dealing with nasal discomfort. Slow, deep, and steady breathing can help relax the nervous system and reduce nasal congestion. Gentle daily movement and light exercises may support better airflow through the lungs and sinus areas. Your living environment also plays a major role in how your symptoms feel day to day. Keeping your space clean, well ventilated, and low in dust can reduce exposure to common irritants. Diet is another factor that often gets overlooked. Foods that increase mucus production may make symptoms like runny nose or congestion feel worse. Gradually reducing refined sugar, heavily processed foods, and excess dairy can help the body feel lighter. Choosing fresh vegetables, fruits, and minimally processed foods supports overall immune balance. Staying well hydrated helps keep the airways moist and more comfortable. Proper rest and consistent sleep schedules allow the immune system to recover and function more steadily. Over time, these small adjustments can help reduce the intensity of allergic reactions. The key is consistency and listening to your body rather than forcing quick results. Yoga is an ancient wellness practice from India that is now widely used as a complementary approach alongside modern medicine. Within yoga, the bee breathing technique is a simple breathing exercise that supports respiratory and nervous system health. Research suggests that this breathing method may help reduce anxiety, improve focus, and support sinus comfort. When practiced consistently, bee breathing may help ease common symptoms associated with chronic sinus congestion. The technique gets its name from the gentle humming sound made during exhalation, similar to the sound of a bee. This humming creates subtle vibrations that encourage airflow through the nasal passages and sinus cavities. Improved airflow can help open blocked sinus pathways and support proper ventilation and drainage. This process may also reduce the buildup of bacteria and airborne irritants inside the sinuses. Another benefit of humming during exhalation is increased production of nitric oxide in the nasal passages. Nitric oxide helps widen blood vessels and supports healthy circulation in the nasal tissues. This can improve temperature and moisture balance in the nasal lining, making sinus drainage easier. Bee breathing also promotes relaxation, which is important because stress can worsen chronic sinus symptoms. To begin the exercise, sit or stand comfortably in a quiet space and gently close your eyes. Lightly place your thumbs over your ears or ear flaps, allowing the remaining fingers to rest softly on your face. Inhale slowly through the nose, then exhale gently, while producing a steady humming sound. As you breathe, bring your attention to the area between the eyebrows to encourage mental focus and calmness. This exercise can be practiced once or twice daily, for about 10 to 15 minutes each session. With regular practice, bee breathing may support sinus ventilation, reduce mucus buildup, and ease nasal swelling. This technique is not recommended for individuals who are pregnant, have epilepsy, chest pain, high blood pressure, or active ear infections. If you have any underlying health conditions, consult a qualified professional before practicing this breathing exercise. After reviewing breathing practices that may help relieve sinus discomfort, let's turn our attention to a traditional herbal approach that many people often ask about. One folk remedy frequently mentioned in discussions about sinusitis is the betel leaf, along with various ways it is traditionally prepared and used. In many traditional practices, betel leaf has long been viewed as a familiar herbal ingredient believed to support general wellness, including sinus comfort. A commonly shared method involves steaming betel leaves and inhaling the warm vapor as a home-based practice. People often boil betel leaves in water, sometimes adding ingredients like mint, kaffir lime leaves, or ginger to enhance the aroma. The resulting steam is typically inhaled for about 10 to 15 minutes, often using a towel to help retain warmth. This warm vapor, combined with herbal compounds, is thought to temporarily loosen mucus, ease congestion, and soothe irritated nasal tissues. Another method sometimes discussed is diluting betel leaf extract and applying it gently around the nostrils. Some believe this practice may help reduce bacteria and inflammation, although such claims are largely based on personal experience. Drinking water boiled with betel leaves is another approach that has been passed down through word of mouth. Traditionally, around 10 to 15 grams of fresh betel leaves are boiled, and the liquid is consumed in 2 servings per day. This practice is believed to help warm the body and support immune resilience, which may ease sinus discomfort. In traditional descriptions, betel leaf is considered warming and mildly spicy, with properties thought to promote airflow and relieve discomfort. However, so far, scientific research has not confirmed that betel leaf can cure sinusitis. Because of this, such remedies are generally considered anecdotal and lack strong scientific evidence. There are also potential risks, as undiluted betel leaf extract may irritate the nasal lining and worsen symptoms. Depending solely on folk remedies may delay proper diagnosis and make effective treatment more difficult. For safe and appropriate sinus care, consulting a qualified medical professional is strongly recommended. Based on an accurate diagnosis, doctors may suggest home care measures such as saline rinses, warmth, and avoiding smoke or dust. When needed, medical treatment can include antibiotics, corticosteroid nasal sprays, or antihistamines. In more severe or long-lasting cases, endoscopic sinus surgery may be considered to improve sinus drainage. If symptoms last longer than 10 days, worsen, or involve facial pain and discolored discharge, medical attention becomes especially important. Seeking care early can help prevent complications and ensure the most suitable treatment. For professional support, individuals may contact the MLATC hotline at 1-900-565656 for guidance and proper evaluation. It's important to recognize that these traditional practices do not fully cure sinusitis. At best, they may help reduce certain symptoms or provide temporary relief for some individuals. They should never be viewed as a substitute for medical treatment or prescribed medication. Delaying or stopping proper treatment can allow the condition to gradually worsen over time. Traditional remedies are best used only as supportive care, alongside guidance from qualified medical professionals. Maintaining healthy sinuses requires patience, informed decisions, and appropriate medical advice. If you found this information useful, please consider liking the video, subscribing to the channel, and enabling notifications for more health-focused content. Thank you for watching, and we look forward to sharing more reliable and responsible health information with you.